I'm supporting our amendment for carers, especially for the changes to the DRE to help our carers to get the support and the guidance they need. I don't think that anyone can ever realise what pressure carers go through until you are put into that position. I think that the council over the years has done a lot of work, working with the carers to help get their profile raised, and the fact that they do a remarkable job for their loved ones that they care for. Even though I haven't, as I'm sure other councillors in the room, haven't been updated about the Bridges contract and whether targets are being met, their contract, which was set when I was the carers champion, seemed to be a great way forward, and our carers were going to be looked after and had a quicker and safer way to get help when needed, and hopefully not many of them would fall through any cracks. I would ask if we could have an update to all councillors soon, telling us just how effective the contract is and that the targets are being met. Before COVID, we were doing a lot of co-production work with the carers, making sure that their voices were heard. We had carers ticks and carers passports. Just at a meeting this past week, several carers were telling us that their loved ones who have gone to hospital, the staff didn't even know about the carers passports. This is the sort of thing that our council, when working with the bodies, need to make sure is happening. Having something to let the staff know that they are a carer or have a carer is essential to make sure that our carers get the best service ever. I've had great pleasure in being your carers champion for 8 years, and I really got to know the carers groups, feeding back their views to the council and working with the many dedicated officers, which we do have. We even arranged a carers day, which I hosted. I did bring a written report to Adult Social Services, it was called, to each meeting, and I would ask if that's still being done by the new carers champion. And if the carers' thoughts have been referred back into the council, and what has the carers champion done to make sure that the carers have heard of the outcome or the answers of the questions they have asked? I hope you will accept our amendment. Thank you, Chair.